Hello everybody, my name's Khalid and today I'll be talking about aneurysms. Now, aneurysm is a vascular condition which in certain situations can prove to be fatal. Therefore, it's very important that we know about this problem and also have some idea of how to deal with it if someone does have an aneurysm. Before I go into aneurysms, a little bit about blood vessels. In our body, there are two types of blood vessels. One is called an artery and the second one is a vein. Arteries take blood away from the heart to all parts of the body, and veins are those blood vessels that bring blood back to the heart. Lots of people get confused between what's an artery and what's a vein. They start calling veins arteries and arteries veins and think they're the same thing. They are not the same thing. Arteries take blood away from the heart and veins bring blood back towards the heart. Okay, now this is a blood vessel that I've drawn. Now if you take a good look at this blood vessel, it's straight, there's nothing wrong with it, blood can flow straight through it. Quick example. Now compare this blood vessel to this one. You can see there's an obvious difference between the two. Whereas this one is straight, parallel, this one is swollen. It's bigger than it should be. And that is exactly what an aneurysm is. And a blood vessel gets bigger than it should be, it bulges out, and that's called an aneurysm. Another way to understand an aneurysm is, those of us who are old enough to remember when cars used to have tubes in their tires. Once a tube got old, it would bulge out in one place, get bigger, and eventually the worry is it could burst. Same thing can happen to an aneurysm. The blood vessel gets weak at a point, starts to bulge out, gets bigger, eventually it gives way and can burst, having catastrophic consequences. Now, an aneurysm can develop either in an artery or a vein. In other words, those blood vessels that take blood away from the heart to the rest of the body, the arteries, they can have an aneurysm. And those blood vessels that bring blood back towards the heart, the veins, they can also have an aneurysm. However, aneurysms are more common in arteries. Therefore, at the moment in this video, I will only be talking about arterial aneurysms. Any artery in the body can have an aneurysm in it. You may have an aneurysm in an artery going into the brain. You could have an aneurysm in the main artery in your chest. You can have an aneurysm in the artery in your tummy, aneurysm in the arteries supplying your arms, aneurysm in the arteries supplying your legs. In other words, any artery in the body can have an aneurysm. However, the most common aneurysm which is found is in the main artery that runs through the tummy. That artery is called the aorta or the abdominal aorta, and this kind of aneurysm is called an abdominal aortic aneurysm. Because an abdominal aortic aneurysm is the most common type of aneurysm, that is the aneurysm about which I will be talking for the rest of the video, and in future I will be making videos on other kinds of aneurysms as well. You will now be seeing two pictures on your screen. In one picture there is the abdominal aorta, which is absolutely normal with no problem in it, and in the other picture you'll see that the abdominal aorta at its bottom end is bigger than it should be. It's swollen up, and this is a picture of an abdominal aortic aneurysm. Now the question is how to diagnose a patient with an aneurysm. How do we find out that someone has an aneurysm, or more importantly, how does a patient know that they've got an aneurysm? This is quite difficult because quite often abdominal aortic aneurysms are asymptomatic, which means the patient doesn't know that they've got the abdominal aortic aneurysm. Sometimes people have an ultrasound scan of their abdomen or a CT scan which picks up the aortic aneurysm, and that's how patients are diagnosed. In certain situations, patients start getting back pain because the abdominal aorta that I showed you is situated right next to the spine. Therefore, when the aorta gets bigger, it puts pressure on the spine, and that pressure can cause backache in some patients. However, I want to make it very, very clear that I am not saying that everybody who has back pain has an abdominal aortic aneurysm. There are many, many causes of back pain. This is just one of them which we need to bear in mind. When a patient is diagnosed with an abdominal aortic aneurysm, it's very, very important that it is appropriately managed and treated. Because the risk is, as I've already told you, the aneurysm can burst. And if it bursts, patient can die straight away. Some people say an aneurysm bursts, others call it a leaking aneurysm. It's the same thing. The bottom line is the artery has a hole in it, blood leaks out, and death can happen very, very quickly. If an aortic aneurysm does leak or burst or rupture, whatever you want to call it, majority of the patients do not make it to hospital. They die before they get to hospital. Those people who do get to hospital, quite a lot of those patients are so unwell that they cannot have an operation to fix it because it's too late. And those who do undergo an operation, quite a lot of those end up with long-term complications and not surviving, and a very small minority of patients who have a rupture actually make a full recovery and return to their daily activities after discharge from hospital. Therefore, aneurysm management is very, very important. Now, we have a patient who has been diagnosed with an aneurysm, whether it's because they've had back pain, whether it's an incidental finding on a different scan, whatever, someone has an aneurysm. So how is it managed? First thing is, not all aneurysms need an operation. The operation of an aneurysm depends upon the size of the aneurysm, and there are guidelines in England called the UK Small Aneurysm Trial, which showed that abdominal aortic aneurysms should only be operated upon if their size is 5.5 centimeters. The reason for that is, when an aneurysm measures less than 5.5 centimeters, the chances of it bursting are not very high. However, once the aneurysm reaches 5.5 centimeters and gets bigger, the bigger it gets, the greater the chances of it bursting. So why not operate on aneurysms that are smaller than 5.5 centimeters? What's the reason? The reason is that aneurysm surgery is very high risk. If you repair an aneurysm in a patient, there is a risk to their life, there's a risk to their kidney, there's a risk to their bowel, there's a risk to their legs, along with many other things associated with it. So the risk is quite high, but when the aneurysm isn't very big, the chances of rupture is quite small. As the size of the aneurysm increases, the risk of surgery are still the same, but as you can see, the risk of rupture is getting bigger. Therefore, 5.5 centimeters is the threshold that we take, at which we say, right, now we need to try and do something about this aneurysm. Because aneurysm surgery is quite high risk, and unfortunately, not every single patient who has an aneurysm that's big enough to be repaired is able to have the operation. The patient has to be in a reasonable state of health, otherwise they may not even survive the operation. So therefore we leave the aneurysm and say, well, by doing the aneurysm repair, he's likely to die quicker as if we were to not do anything about it. Therefore, the general fitness of a patient is also very important when considering these cases. Now, someone has an aortic aneurysm and the size of the aneurysm is not 5.5 centimeters. In such situations, the patients are put on a surveillance program. They get an ultrasound scan at frequent intervals to measure the size of the aneurysm. And once the size of the aneurysm gets to 5.5 centimeters, then the preparations for surgery are started and the patient gets assessed for fitness of surgery. In the UK, there are quite a few places that have the National Aneurysm Screening Program, in which every male who is 65 years old gets invited for an ultrasound scan of the abdomen to check for an abdominal aortic aneurysm. and if an aneurysm is found, then it's treated accordingly. Therefore, if you do get an invitation to go to the screening program, please do. When a patient is diagnosed with having an abdominal aortic aneurysm, then the very first thing to do is to make sure that their vascular risk factors are controlled. Vascular risk factors are 5: hypertension, diabetes, smoking, hypercholesterolemia or high cholesterol, and the last one is family history. So if someone's got a family history of vascular disease, then that patient is more likely to get it. The final one, obviously we can't control. However, we need to make sure that if the patient is diabetic, the diabetes is well controlled. If they've got hypertension or high blood pressure, the blood pressure stays well controlled. Cholesterol levels are controlled, and smoking is controlled. Now, when the aneurysm gets to 5.5 centimeters and the patient is fit to have an operation, then there are 2 ways in which abdominal aortic aneurysms can be treated. The first method is traditional surgery, in which there's a big cut in the tummy. Sometimes it's top to bottom, sometimes it's across, and sometimes it's on the side. But there's a big operation in which the abdomen is opened, the aneurysm is taken away, and the segment of the aorta where the aneurysm was is replaced by an artificial tube. So therefore the blood flows through that tube and not through the aneurysm. Now, in this picture you can see that the area of the aorta where the aneurysm was has been taken away, and in its place there is an artificial tube through which the blood will flow, and this is the operation done to treat an abdominal aortic aneurysm. I will repeat again that this is very major surgery with significant risks associated with it. Over the last few years, a newer technique to repair abdominal aortic aneurysms has been taking place, and in this technique there is no cut in the tummy at all. Through the artery in the groin, a wire is passed into the aorta all the way up, and then a stent is placed in the aorta. What happens is that the stent is placed inside the abdominal aortic aneurysm, therefore the blood flows through the stent and no blood gets into the aneurysm sac, which in essence treats the abdominal aortic aneurysm. In this picture you can see that there is a stent placed inside the abdominal aorta, therefore the blood will be flowing through the stent and not through the aneurysm. This technique is known as endovascular aneurysm repair. In short, it's called EVAR, E-V-A-R. This technique has become quite popular over the last few years because, as I said, it doesn't require a big cut. It's done through a small cut in the groin. Sometimes it's done just by passing a needle through the groin and extending that hole slightly. However, not all patients are suitable for this treatment. The way in which an aneurysm is treated depends on many factors, like the size of the aneurysm, the angles of the aneurysm, the condition of the artery inside, are the arteries straight or are they twisted? I mean, there are lots of things that can influence which technique is to be used for the treatment of the aneurysm. Both of these techniques, either the traditional open surgery or endovascular aneurysm surgery, EVAR, have their pros and cons. There are some advantages to both and some disadvantages to both, and they all have to weigh up when deciding which treatment to go for in a specific patient, because if a technique works in one patient, it does not necessarily mean it'll work in another. Everyone is different and every patient has to be taken on an individual basis. So guys, I've tried to explain to you what an aneurysm is, and specifically what an abdominal aortic aneurysm is and how it is managed. I would like to stress again how important it is that abdominal aortic aneurysms are managed appropriately, because if not, then a patient can die from it. There are quite a few different kinds of abdominal aortic aneurysms as well, like fusiform aneurysm, saccular aneurysm, mycotic aneurysm, suprarenal aneurysm, infrarenal aneurysm, but it's not really possible to talk about each individual type in this video. Therefore, I've just given you an overview and hope you've understood. If you have any questions or any queries, please feel free to comment or drop me an email and I'd be happy to answer. If you found this video useful and have enjoyed it, then please don't forget to hit the subscribe button, and see you next time with a different topic. Thank you very much.